Yesterday, 25 people have passed away. We pay respect and condolences to the deceased and the family members as well. The third wave is passing through the peak, and we are seeing a decrease in the trend. However, right now we're still at the initial stage of drop, and the drop speed is also at a very slow one, so we cannot be relieved. Until the past week, until January 9th, we have seen an average of 773, which is a decrease compared to 950 from the previous week. And for the reproduction level, it has been lowered to 0.9 as well. We are seeing a decrease in massive and cluster outbreaks, and we are seeing more increases that are coming from contacts. When we look at the path of the infection, in the middle of November, the group outbreak was at around 60%. However, we saw a decrease to 30% last week. However, as of mid-November, contact from those who were confirmed was at 20%. However, last week it has increased to 40%, which shows that for the current transmission, it is coming more from personal gatherings and travel rather than from multi-use facilities that we saw in November. Until January 17th, we have to make sure that we can decrease the size of newly confirmed cases for us to be able to control disease control. Also, starting from February, we believe that we will be able to control it better through vaccination and etc. So right now we are at a more important point. Until January 17th, for the next week, please refrain from having any personal gatherings or appointments, and please minimize contact with others. I will now explain about the disease control measures. Due to a very cold weather and because of weekend, we have tested around 60,000 cases yesterday. And for the reports on suspicious cases, we have reported 44,000 cases. And in the metropolitan and non-metropolitan areas, we have tested 55,000 cases in the screening centers. We want to thank all of the people on site and the relevant personnel for all your efforts despite the cold. Now I will explain about the medical response situation. As of the metropolitan area, right now we have 0 people who are waiting to enter into hospitals. Right now we have 205 hospital beds for the critically ill across the country, and we have more than 100 secured in the metropolitan areas. For those with light or mid-level symptoms, we have also secured enough beds in the life treatment centers and across other areas as well. We have more than 10,000 hospital beds secured for them. Comprehensively, we have sufficient system to control the disease in hospitals, and we can respond without much issue even if there are 1,000 newly confirmed cases happening on a day. And we are also strengthening measures for the medical management as well. We have seen cluster outbreaks in the senior home cares, so we have decided to strengthen the measures so that we can minimize further spread. We're going to strengthen the measures, especially during commuting times. And we are also making sure that the staff members are tested every week. And for people with symptoms, we're going to make sure that we quarantine them at a very rapid pace. And when there are cluster outbreaks, patients would be quickly transferred to the dedicated hospitals, and for those who have been in close contact, they will be isolated to single-person rooms. And we are also going to make sure that we bring in social workers for any care that are required. We're also strengthening measures in the homes for the disabled. For the patients in hospitals with a lot of confirmed cases, we have transferred them. And we are also making sure that we have the necessary quarantine practices being implemented. And we also have supported 6 care workers per hospital as well. We are now going to make sure that all staff in the residential areas will be going through preemptive tests as well. And when there are patients that are generated, we're going to make sure that we have emergency care workers being dispatched additionally as well. For long-term care facilities as well, as we have announced, for areas that have seen cluster outbreak, we have dispatched more staff members, and for patients who have been confirmed, they have been transferred to dedicated hospitals, and we're making sure that we are carrying out improvement measures without any issues. Now I will explain about the foreign personnel facilities. We have seen the variant form of COVID-19 transmitting across the country. So there was the perception and the issue that foreign residential areas could be blind spots, so we have decided to strengthen these areas. Starting from January 4th, we have done a testing for all, and everyone has tested negative. And we are also carrying out testing for all of the staff members as well. And for those who are newly entering or for those who are newly confirmed, they are actually going through a PCR test before they can be moved to protective facilities as well. And we're also making sure that we're minimizing crackdowns on the simple illegal migrants, and we are strengthening measures to prevent COVID-19 as much as possible. So rather than protecting those illegal immigrants in our facilities, we are also coming up with a grace period so that we can actually have them transferred if they cannot pay the penalty. And we are also going to strengthen other measures as well. And for those people who are being protected in facilities, we are strictly applying the rules so that they have to wear face masks at all times. We are also going to make sure that we thoroughly manage foreign protective centers in the future so that we can prevent any COVID-19 from coming from abroad. Now I will explain about the customized disaster relief fund. The Venture Ministry has come up with a support fund for those who have been damaged by COVID-19. For 208, actually there have been 28,000 people who have been damaged due to COVID-19. So we're going to make sure that we provide funding for these small businesses who have been affected by COVID-19. For those who have been harmed due to the measures such as the stopping of operation with the strengthened social distancing measure, we're going to provide 2 million or $3 million won as necessary, and we're also going to provide 1 million won for others. And we are targeting 10% of payment, and we're going to proceed with the second form of payment in March. And for those small businesses who had to stop operation, we are also providing lending to them as well. So for those, they can actually be provided loans of up to 10 million won at low interest rate, and they can also make use of this to have exemptions in the deposits or decreasing interest rate as well. So such loan planning will receive applications from end of January, and we're going to make sure that we implement it as quick as possible. We are also implementing whole return package and online fellow support. So we have other support projects that are going to be implemented starting in January. And also for the SMEs and small businesses, we're going to make sure that we have other measures such as decreases in the deposit. And we're going to make sure that we provide liquidity that is amounting to as much as 5.5 trillion won. So I hope that everyone will contribute, and we also want to thank all the small businesses and the SMEs who have worked together with us to overcome COVID-19. Now I will explain about the recruitment testing that we're going to carry out for the teachers. So right now, the second testing will start since January. The government, based on the decision of the legal court, will make sure that we allow the newly confirmed people to be able to take tests as well during the recruitment testing. So when people have been confirmed, they'll be able to take the test in designated centers. With the winter season, many countries across the world, including Korea, is facing a resurgence of COVID-19, and many people are having hard times. It is very difficult to control the transmission, and there are radical measures being taken, such as lockdown. However, in Korea, we have not taken lockdowns, and we were able to control it at a manner that we are overcoming the third wave. We want to thank our citizens who have taken part in social distancing, and we also want to thank the small business owners who have taken part as well. And also, in the cold season, there are staff members who are playing a very important role on site, and we want to thank all the medical practitioners for that as well. We want to express our gratitude to all of you once again. We want to apologize for the sacrifices that you have to make, and we want to thank you once again. Right now, we are seeing a decrease in the number of newly confirmed cases. However, we still have to make sure that we are vigilant. Right now, it's only been a week since we have seen a decrease, and the speed of slowdown is not so steep. And winter season is still remaining, and we still have 2 months to go before we get rid of the cold. Until now, despite all the difficult situation, everyone have cooperated, and we were able to see such an achievement. However, we want to make sure that this is prolonged, so we want to ask you to continue to be vigilant and make more efforts for the next week. Please refrain from having any personal gatherings or appointments and any contact with others, and please make sure to refrain from visiting places where you're not wearing face masks. And please make sure that you are tested even if you're a little bit suspicious. The government will also make pan-government efforts so that we can limit further spread. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.